The stark contrast between healthcare costs in the UK, Canada, and many European nations compared to the United States is a glaring reflection of differing healthcare philosophies. At the heart of this disparity lies the structure of healthcare systems. The UK's National Health Service, NHS, and Canada's Medicare exemplify single-payer or universal coverage models that prioritize equitable access to healthcare for all citizens. These systems negotiate directly with providers and pharmaceutical companies, effectively controlling costs and ensuring that healthcare remains a right rather than a privilege. One of the most significant factors contributing to lower healthcare costs abroad is the reduced administrative overhead associated with these systems. In countries with publicly funded healthcare, the complexity of navigating multiple private insurance plans is largely eliminated. This streamlined approach leads to significantly lower administrative costs, enabling more funds to be directed toward patient care rather than the bureaucratic labyrinth that characterizes the U.S. healthcare landscape. Consequently, the focus shifts from profit-driven motives to a more patient-centered model that prioritizes health outcomes. Price controls further enhance the affordability of healthcare in these nations. Governments actively regulate the costs associated with medical services, including hospital stays, physician visits, and pharmaceuticals. This proactive stance prevents the excessive charges that often plague American consumers, where the lack of regulation allows for rampant price inflation. In the U.S., the sheer power of pharmaceutical companies often dictates drug prices, leading to exorbitant out-of-pocket expenses for patients. In contrast, countries with universal healthcare negotiate prices, ensuring that medications remain accessible to all. Moreover, the emphasis on preventive care in publicly funded systems plays a crucial role in reducing overall healthcare costs. By providing universal access, these countries encourage early intervention and preventive measures, which ultimately diminish the need for costly emergency services. The proactive approach not only improves public health outcomes, but also alleviates the financial burden associated with treating advanced illnesses. In stark contrast, the U.S. operates within a private insurance-dominated framework where high administrative costs and profit-driven motives inflate healthcare prices. Even with insurance, many Americans face significant out-of-pocket expenses, leading to medical debt that can cripple families.